I'd always been interested in medical missions. But, you know, when you have a family of kids and a mortgage and everything, it kind of ties you down a bit. So when all our family but one had grown up and more or less left home, there was an opportunity. So I first went out to Nepal for just a couple of months to see if I would fit in. For one thing, I didn't know much about missionaries. I thought they were all rather weird people, sanctimonious, you know. Couldn't have been more wrong, of course. And could I fit in? Could I be a member of the team of this mission hospital? Well, I don't know whether I made any great contribution or not, but 3 years later, we got a call to go back for 4 years. We stayed for 12. So that's how it all started. I was able to be there with some skills, but a lot of deficiencies, to look after patients that wouldn't otherwise get much in the way of care. Because Nepal was a very backward country, I'm sure you realize, and the healthcare system is very shaky. So it was here I was able to do work that might never get done. That was very rewarding. I enjoyed the other doctors and nurses that I was working with. Many of them were local people, Nepalis. So I had to learn the language. In fact, my boss, the administrator of the hospital, was a little Nepali guy, quiet, soft-spoken guy, but he could boss me around if he wanted to. I was working under him. That was good for me. And another very rewarding thing was that it was possible to teach some of the young Nepali doctors the basics of surgery. And I think that was, I found that as rewarding as anything. Alison, I think she enjoyed it, although it's hard to be a housewife in a developing country, because she was able to be kind of like establish a kind of a hospitality center. She was very good at that, bringing people together and giving them a decent meal, you know. So those were, they were wonderful years. Wonderful years. I can't deny that.